The isolation has been a killer. I mean, literally, it's been a killer.
Isolation is a friend of addiction.
Whenever the pandemic happened, I was pretty much shut off. I had purchased some pills that were pressed with fentanyl. I overdosed, nearly died. By the grace of God, I'm still here.
Ted McCord found help at Isaiah House in Kentucky last summer, a facility still offering some in-person treatment.
I thank God for the ability to do things virtually. But whenever you're in active addiction, there's really nothing better than that face-to-face.
For many Americans fighting substance use disorders, these shutdowns meant shutting out the people who could help.
We have a lot of people that have gone back into active use.
Melissa Tapman runs a recovery group in Brown County, Indiana. She closed the doors for a few weeks at the start of the pandemic.
There's just something about routine. And once we kind of get out of it, it's hard to get back into those routines.
Documentary filmmaker Michael Hussein has been tracking the nation's drug epidemic from the vantage point of Brown County.
You walk through Brown County, it's like a Hallmark movie.
Behind closed doors, Hussein says there was a growing drug problem, something the town had been actively trying to address, but COVID-19 made that difficult.
The sheriff was concerned that this isolation was causing this. He also said it simply could be that we've got what he called a bad batch of narcotics going around this community. A few months later, we came back and he said it was actually both.
It's not just a Brown County problem or even a rural versus urban thing. According to a December CDC report, the country started losing its progress on the overdose battle before the lockdowns, but the numbers accelerated from March to May of 2020.
These are part and parcel of what happens when we have a pandemic that requires the kinds of restrictions that were put in place.
Now the Biden administration looks to tackle the issue through its rescue plan, asking Congress for $4 billion to go towards mental health and substance abuse services. However, his team faced criticism after squashing a Trump administration plan to make it easier for most doctors to treat addicts with drugs, including using controlled substances. We asked the Department of Health and Human Services if and when they would proceed with that rule. They received our request but didn't respond to the question. Even though Trump's plan was lauded by many healthcare groups, in an email to Newsy, former Trump administration Health and Human Services Assistant Secretary Eleanor McCance-Katz says President Biden made the right call, saying allowing doctors to bypass required addiction and psychology training necessary to administer controlled substances would deliver, quote, second-class care to a large number of Americans, often poor minority.
This is all just part of the delicate balance ahead for this administration as they work to keep Americans safe from dueling health crises. Amber Strong, Newsy, Northern Virginia.